Special healthcare needs. What is a special healthcare need? A condition requiring medical management, healthcare intervention, and/or use of specialized services or programs. Healthcare for individuals with special needs requires attention, adaptation, and accommodative measurements beyond what are considered routine. This may include one or more of the following: physical limitations, mental limitations, heightened or decreased sensory attributes, and behavioral, cognitive, or emotional impairment. Organizations not limited to these may be congenital, developmental, disease-related, post-trauma, or environmentally related. 15.1% of children under 18 years of age in the United States, 11.2 million children, and 23% of U.S. households with children have at least one child with special health care needs. General considerations when managing a special needs patient. A. Maintain and support the airway, breathing, and circulation. Perform your ABCs. B. Involve parents, caregivers in the assessment and manage of care. Check medical history. Is the patient acting appropriately? Normal baseline vital signs, medications, and the caregiver's go bag or rescue kit for the patient. Supplies necessary to manage the patient's special needs. And C. Speak quietly and calmly. D. Employ slower movements and firm, secure contact. E. Request that the caregiver accompany EMS when transporting the patient. And F. Take time to explain your actions. Special considerations and questions when assessing a special needs patient. Do they have a latex allergy? A greater incidence, especially in spina bifida patients. What is their developmental level? Do they have vision or hearing problems? Do not assume that a patient with a physical disability is cognitively impaired. Determine preferred hospital. Common equipment EMS providers may encounter. A tracheostomy tube. There is a surgical opening in the trachea. Keep it clean and dry and suction as needed. For oxygen delivery, use blow-by, face mask or non-rebreather mask, or BVM, which may need an adapter. Feeding tubes, which provide nutrition to the patient who is unable to eat by mouth. Common complications may be infection, occlusion, malpositioned or dislodged tube. They may need transport to an ER for tube replacement, or there may be tube deterioration. Cerebrospinal fluid shunts, or CSFs, are a device used to drain excess CSF from the brain. Hydrocephalus is a shunt runs from a ventricle in the brain, under the skin, and down the neck into either the peritoneum of the abdomen or the right atrium. Common complications may be a brain infection, obstruction which may lead to increased intracranial pressure, or peritonitis. Dialysis shunts, peritoneal dialysis, hemodialysis fistula, indwelling abdominal catheter. Common complications may be catheter infection and peritonitis. Urinary catheters. There are Foley catheters and suprapubic catheters. GI bags, or colostomy bags, divert stool away from the colon or large intestine. Ileostomy diverts stool from the ileum into an external bag. The contents do not pass through the large intestine at all. The content is liquid or semi-soft with a green appearance. Cognitive impairments. Cognitively impaired or non-communicative patients may still be aware of your actions and words. Despite their apparent age, Cognitively impaired patients might still need a caregiver. Common difficulties encountered in emergency medicine when dealing with cognitively impaired patients in the EMS setting is obtaining an accurate and complete history. Accommodations may be necessary when providing patient care. Allow adequate time for gathering a history, performing an assessment, patient management procedures, and preparing the patient for transport. Common cognitive impairments. Intellectual development disorder. It is generalized disorder appearing before adulthood characterized by significantly impaired cognitive functioning and deficits in two or more adaptive behaviors. Syndrome mental retardation is an intellectual deficit associated with other medical and behavioral signs and symptoms. Non-syndromatic mental retardation is intellectual deficits that appear without other abnormalities. Down syndrome is a complex of symptoms associated with mental retardation caused by chromosomal abnormalities. Common physical signs may be intellectual developmental disorder, decreased muscle tone at birth, upward slanting eyes with small skin folds in the corner, small abnormally shaped ears, flat facial features with small nose, wide, short hands with short fingers, hyperflexibility, known cardiac issues, C-spine instability, a large tongue, thyroid issues, visual problems, and are 15 to 20 times more likely to develop leukemia. Common mental and social complications may be wandering or running off, obsessive or compulsive behaviors, stubborn or oppositional behaviors, impulsive behavior, poor judgment, a short attention span, and/or slow learning. Cerebral palsy is when a group of chronic, non-progressive disorders caused by damage to the motor centers of the brain in the early stages of life. Most of these problems occur in the womb, but can happen anytime during the first 2 years of life while the brain is developing. It is characterized by abnormal muscle tone and posture, muscular spasms, hearing and vision problems, seizures, and some communication difficulty. Cerebral palsy may be caused by low levels of oxygen, infection, a head injury, Rh incompatibility, infections in the mother, rubella, herpes, simplex, etc. Transport assistive devices such as walkers or wheelchairs with the patient. Do not assume cognitive disability based on physical disability. Many CP patients have normal or mildly decreased cognition. Assessing patients with autism spectrum disorder. Know that autistic patients are aware of what is happening. Explain your actions. Include caregivers in the assessment. No sudden movements. Show the patient what you will do. Demonstrate on a caregiver if available.